So excited to have you with us today for our first in this series of KM trainings on KM basics and assessing KM needs with the Knowledge Success Project. And go to the next slide, Erin. Thank you. So just a bit of housekeeping before we get started in our agenda today. A few points we'd like to review. Please add your thoughts and questions to the chat. We welcome, please keep introducing yourselves there. I see a few of you have started to introduce yourselves there. Thank you so much for that. Welcome and thank you. And it looks like we have folks from the Philippines, Malaysia, Pakistan. So thank you so much for joining us today. Please keep yourselves muted throughout the training when we're in our plenary session. There'll be times, for questions that you can add to the chat. We'll have time for small group discussions in breakout rooms, and this will be the time for discussion as well as questions and conversation. If you'd like to read captions, you can do that by selecting them by clicking the icon with the 2 C's at the bottom of the Zoom screen on the Zoom menu. This icon should appear on your Zoom menu. And if you'd like to hide the captions later, you can do so by selecting Hide Subtitle from the menu that appears. The training will be recorded and you will receive the recording and the slides of the plenary sessions. The small group breakout sessions won't be recorded in an effort to foster a safe sharing environment. So we really encourage open, and really honest dialogue and sharing. Thank you. Next slide. So I'd like to turn it over to our KM Regional Officer for Asia, Mina Arunvantham.
A warm welcome from Meena Arivanandan. I am the Asia Regional KM Officer for Knowledge Success at JHUCCP. Thanks, Brittany, for giving me this opportunity to share a little bit about Knowledge Success. We are a $35 million project, 5 years, funded by the USAID's Office of Population and Reproductive Health. Our implementation period is from 2019 to 2025, and we're led by the Johns Hopkins Center for Communications Program in partnership with AMREF Health Africa, Busara, and FHI 360. Our aim is to support learning and create opportunities for collaboration and knowledge exchange within family planning and reproductive health. The next slide, please. Thanks, Erin. I'd like to introduce you to the Knowledge Success team. Some of you may already know some of us here. So Brittany is our program officer, and you just got the welcome note from her. We also have Pranab Rajmandari, the regional KM advisor in Nepal. Sophie Weena in Baltimore, she's the program officer. You may know Anne Ballard-Sara, she's the partnerships team lead. Eva O'Connor, the FB Insight manager, and Erin Bras. Sorry, you are a public health graduate, right? Sorry, apologies. Okay, thank you. So let's have a look at the agenda. Okay, so we're going to have a look at the KM basics, get a brief understanding, assess KM needs, and in assessing KM needs, you're going to be doing a practical exercise. A very interesting creative tool is going to be used. It's called the KM Persona, and we're really excited to share it with you. Next slide, please. First of all, let's do a little icebreaker. But for this role, you will need to use the annotate feature. A show of hands. Do you all know how to use the annotate feature? Anyone who doesn't know? Okay, never mind. I'm going to give you a brief intro anyway. If you're looking at the Zoom screen, take a look at the top for view options. Click the button and then go to annotate. Once you click on annotate, you will find a little strip bar appears either at the bottom of your page or on your left. And on that, feel free to use any of the things you see above. There's a text, there's a writing tool, and so on. So if you can just quickly tell us, what is the one item near you right now that represents who you are? I'll give you about a minute or two. Someone has already shared something? Or not? So as I said, go to view options, click on the drop-down menu and look for annotate. Click on that and it will take you to a sidebar. Ah, good. So I believe there are at least 16 of you here. And so I'd like to see more examples on the sheet. Okay, a book, computer, earphone, bond paper, glasses, learner. Okay. I'm curious to know how glasses represents who you are. That's really interesting. Okay, we have some responses on chat, do we? Okay, perhaps not. All right then. Since we have 6 people who've already shared, maybe we'll just hear from one of you. Ah, okay. Somebody said perfume. Okay. Someone shared a calendar. Okay, that's interesting. Do you think we have time to hear from maybe one person? Brittany, is that okay?
Sure.
Okay, so who would like to tell me? Okay, Faisal, you're the one who wrote on the chat box. So tell us, why does the perfume represent you? Faisal, we can't hear you. Maybe you could remove the mute and tell us why perfume represents you.
Yeah, sorry, I was not really using it properly. I said perfume because a perfume is pleasant and refreshing, and other people can be benefited from that. So I think perfume represents me really well.
Wow. Okay, pleasant, and other people can benefit. Definitely a very good choice. Okay, maybe just one more person, and then we will go to the next. Somebody wrote hat in yellow. Why does that represent you? Who was that? Okay, if there is no response, maybe anyone would like to share what they wrote there? Any one more person, then we'll stop. Abigail, yes, please. Tell us.
Hi everyone. Can you hear me?
Yes, but we can't see you.
It's okay. My cam is off. Sorry. But hi everyone. I'm Abigail from the Philippines. So I put here a bond paper. So for me, I represent a bond paper kind of represents me because it's like a blank sheet of paper where I like having a space for ideas to flow. So you write down your ideas on a blank sheet of paper, and also it's a space or a thing where people can collaborate or write down their ideas. So I think providing spaces for that is something I relate to. So yes.
Thanks, Abigail. Really appreciate your response. So thank you very much. We'll move on to a mentee next. So please get your maybe your phone ready, and here are the Mentimeter instructions. Either scan the QR code or go to menti.com and enter this code 63459614. I'm going to add it into the chat box as well, just in case. Okay. So how are we doing? Can you all get into Menti?
I joined it.
Hello, sorry, yes, you had a question? So
I
how are
have
we doing?
joined at menti.com, but it says presentation is in progress.
Okay. So can you see this question?
Yes, yes, I can see it now.
Okay. I hope to see more responses in here. Here we go. KM means organizing information for the benefit of your organization. I'm thinking our community. What does knowledge management mean to you? Management of resources and utilization. Okay, somebody's writing in the chat box, evidence generation. Well, I'm starting to see some patterns emerge. Documentation is strong. Organizing information, systematic organization of information. Anyone else? Compendium of information on practices, learnings, and challenges. Hi, Radhika. No, you have to go into menti.com. Just go into a separate website, menti.com, and type in the code that I'm going to share again in this chat box for you. If anyone still has difficulty, I'm sharing the code. So please go into menti.com and you can type your response there. Okay, we've got 11 responses so far. Can we bump it up to about 15? What do you think? Yes, yeah. Like Brittany says, if you can't type it in the chat, sorry, in the Menti, then share it in the chat box. Okay, very interesting. So we're getting people who say it's documenting and filing and storage and organization, systematic organization. Then you have people who say that it is a process of sharing knowledge within an organization. There is also one that says utilizing people with knowledge. Very clearly, we have many people with different ideas of what knowledge management means to them. And all of these are right, definitely, because you would tend to gravitate towards what pulls you, what attracts you, what interests you. And I think with this, we can safely move on to the next. And I'm very happy to present this on to Erin. Thank you, Erin.
Sure, thank you, Mina. So the next question is, does your organization engage in knowledge management activities? A simple yes, no, or are you unsure? And I'll give another few minutes to answer this poll, but we're already seeing great responses. A majority are saying yes, one is unsure, and a couple are unsure, which is great, which is what we'll be covering today. Basic on what knowledge management is and what some of the activities look like. Great, this is really exciting. I'll go ahead and quickly direct us to the next poll question as we see a lot of these yes or unsure responses come in. So our final question is, if you answered yes to the previous question, to add in a short answer response to what type of KM activities your organization engages in. And you should all see 3 different options. So if you do a couple different ones, feel free to add them all or just a few examples. Great. Similar to our first question, we're seeing documentation, publishing, dissemination, knowledge sharing sessions, youth data, data analysis. These are all really great examples. Documentation is a common theme. Well, this is wonderful. I will go ahead and conclude the Mentimeter. Thank you all for participating. And we'll proceed into the training part of our session. But thank you all. So in this first section of the training, I'll be covering an introduction to knowledge management. To start, let us talk about a pyramid and hierarchy of data, information, and knowledge, and the relationships between the 3. Data has no use until they're presented in a usable form. In their true form, they're just a set of numbers until we start to organize, summarize, analyze, and synthesize them into usable forms of information. At this point, at the second level in the continuum, we give raw numbers and figures. Then we have to interpret, organize, and present information in a meaningful way, such as in a report or presentation, for people to be able to make sense of the data. And to get to the next level, we add another component, the story of the experience or insight, all the pieces that are happening in our heads. And this combination gives us knowledge, this third level, and the power to act effectively. Knowledge can take 2 forms, tacit and explicit. Tacit knowledge is information that is in people's heads, such as their experiences and their know-how. In contrast, explicit knowledge is in a format that can be stored and shared with others, such as in databases or publications. Although explicit knowledge is more easily visible and thus easier to share, most knowledge is tacit. And this iceberg model shown on the screen is commonly used in KM to illustrate this concept. A key challenge is translating tacit knowledge into explicit knowledge so that it can be captured and shared widely. And KM can help with this process of capturing, organizing, and sharing both explicit and tacit knowledge. To talk a little about individual knowledge versus collective knowledge. Individual knowledge can lead to people being experts and empower people, as knowledge is power. But if knowledge is kept at the individual level and not shared, it can lead to control issues and doesn't help people gain the tacit knowledge that some people have gained from years of experience. Collective knowledge occurs when individuals share and synthesize knowledge and accept other people's experiences. Collected knowledge can benefit the entire organization and the broader health field. So now that we understand knowledge, we ask, what is knowledge management? Ultimately, knowledge management, or KM, means different things to different people, but the definition of KM that we often use is a systematic process of collecting and curating knowledge and connecting people to it so they can act effectively. This definition emphasizes the active process. KM is not just putting information and knowledge into the world, but making sure it's presented in a format that resonates with audiences and that people are not only aware of it, but they're being supported to use it. And it's important to note that this is an intentional process. Everyone does some form of KM every day. So you might ask, well, I do this already. Why do I need to learn about this? Well, the reason is that haphazard knowledge sharing isn't as effective. So what we're going to talk about today is a process of doing this intentionally and systematically to meet your needs for both internal knowledge sharing as well as for sharing your knowledge with the larger AYSRH community. And now that you know the definition of knowledge management, pictured here is our knowledge management tools and techniques matrix. Right now, we're going to focus on the outside of the circle and the elements in blue, which represent the various components of the KM cycle. Starting in the bottom right corner is knowledge capture. This involves documenting information that facilitates access to tacit knowledge as well as explicit knowledge. So why is that important? Think about it this way. How many times have we lost valuable knowledge and expertise when a staff member moves on? Perhaps we have a succession plan in place, but there's so many times when they leave and we haven't put a system to retain the knowledge that they gained while they were there. And that can lead us to reinventing the wheel when we could have learned from that person's shared experience. Next is knowledge synthesis or analysis. This involves weeding out unnecessary data, proposing recommendations. We're all inundated with information from so many sources every day, and knowledge synthesis can help us cut through the noise and focus on that key knowledge that can really help us in our work that we want to communicate to our audiences. Next, we have knowledge sharing. This is something that we do every day. In the dissemination and distribution methods that you all mentioned in the Mentimeter through print materials such as flyers and brochures, electronic media such as email and websites, video conferencing, as well as face-to-face knowledge sharing through meetings, exhibitions, presentations. We've covered the value of sharing knowledge and not keeping knowledge in our heads. And again, this might be sharing explicit knowledge or it might be sharing tacit knowledge, and it's important to consider both. Next is knowledge assessment. How is knowledge being utilized? It's important to determine the right monitoring and evaluation indicators using both qualitative and quantitative data. So examples of this might be routine records, web analytics, surveys, focus groups discussions. And finally, there's knowledge generation. So taking all this and creating resources and generating new knowledge based on what is out there. And then this cycle is represented in this way because it doesn't really end, it just keeps on flowing back into knowledge capture again. This matrix also illustrates that KM tools and techniques fall on both a collect-connect continuum and a push-pull continuum. Some KM tools and techniques focus on collecting information. Perhaps the most obvious examples of this are databases and libraries, while others emphasize connecting people to that information, such as workshops and webinars. Similarly, you can think of some KM tools and techniques as pushing information to people, such as news releases and publications, while others provide people with tools so they can pull the information themselves. For example, website search tools. And then these two continuums create a matrix in which KM tools and techniques can be thought of in terms of broad approaches they use in the KM cycle to generate, capture, and share knowledge. So now that we've provided background on KM, we want to talk more specifically about how KM can support AYSRH programming. As mentioned on the previous slide, knowledge is at the foundation of high-performing health systems, successful policies, and achievement of national and regional health goals. KM can help the family planning and reproductive health community, including the AYSRH community, improve equity in health systems and programs, develop localized systems of continuous learning and knowledge sharing, and optimize resources and coordination among regional and national stakeholders. To talk a little bit more about how KM can support AYSRH programs in achieving each of the priorities listed on the previous slide. The practice of knowledge management brings everyone the same fair opportunity to access and use data, information, and knowledge. In terms of quality, continuous learning and sharing, and the application of that knowledge to services leads to health systems that are responsive to patient and population needs. Knowledge management can also address gaps in information pathways between provider knowledge, provider behavior, service quality, service uptake, and health outcomes. And resources are optimized when countries and partners can practice evidence-based decision-making, learning, and adaptation. In terms of facilitating equitable partnerships, knowledge management recognizes local stakeholders as the experts and emphasizes the value of their expertise and relationships. And then lastly, effective programming. Health program capacity is strengthened by lasting practices of learning and sharing that are authentic to where people are located. And I'll now pass it over to Brittany, who will share some key examples of how KM innovations for youth-led or youth-focused family planning and reproductive health programs.
Thanks so much, Erin. This is a wonderful overview. So I'm going to now provide a few examples, and these are by no means exhaustive, but we wanted to just provide several examples of organizations that we've worked with through our work on knowledge success. And these are specific examples that we've worked with through our work on the pitch. So the pitch is an innovative kind of small grants opportunity that funds really creative and forward-thinking KM solutions. It was a multi-year grant opportunity. And these are several pitch winners that we wanted to highlight through this grant opportunity. So the first one on here is AYSRHR Bangladesh, and their innovation is contextualized SRHR folk songs in Bangla. And sexual and reproductive health SRH information in Bangla regional dialects is absent. So AYSRHR Bangladesh identified that this language barrier makes millions of young people really out of reach for SRH programs. AYSRHR Bangladesh intends to leverage their past experience to fill this knowledge gap by creating 5 ballad songs and other types of Bangla folk songs like Puthi and Gambhiri to present locally contextualized SRHR topics to young people through songs and accompanying visuals. The Ministry of Health has previously commended the work of AYSRHR in creating similar songs in Puthi, and this innovation will directly contribute to the realization of the National Adolescent Health Strategy and create more demand among adolescents to access relevant health and SRH services in their communities. Presenting SRHR information through songs in their local language will help young people remember the information and impel stakeholders and policymakers to really rethink future programs and strategies. The songs will be disseminated on the AYSRHR Bangladesh webpage and social media platforms. So AYSRHR Bangladesh has really filled this knowledge gap by creating these songs and other types of folk songs. So AYSRHR Bangladesh is a youth-led development organization that promotes these socioeconomic, social status, and living standards of vulnerable communities through capacity building, awareness raising, and strategic communication and innovative programming. So this is an example of how an innovative knowledge management or knowledge innovation can really advance and impact programming and really fill a gap and address a meaningful AYSRH topic and need. I know we have some folks, or we might have some folks on the line right now, currently with us, who are from SRHR. So we welcome, please add any of your thoughts to the chat. And we might have some time once I get through all of the examples to add some thoughts and share some thoughts as well. So I'm gonna continue on to the next one. So our next example is from the YP Foundation in India, and their innovation is called Safe Sphere. It's a free gender transformative chat box. To address the absence of SRH information, the YP Foundation is developing Safe Sphere, a free gender transformative WhatsApp-based chatbot in English and in Hindi that collates resources, tools, and information and makes them accessible for young people in India. Users can ask questions on various AYSRHR topics. And for many in the country, knowledge around sexual and reproductive health and rights is either absent, or information is very Eurocentric and is unrelatable. It's also cis heteronormative, which means it's very along the lines of very gender binary. It's very focused in looking, at very heteronormative relationships. It's very exclusionary of diverse gender identities and sexualities, and it's very prevention-based. And so to address this chatbot is intended to provide this information as well as resources and tools and information. They can ask questions, like I mentioned. They can also explore tools. They can access safe helpline numbers as well. And they provide this safe and confidential space for young people to really explore and do so on an encrypted platform. This is developed in collaboration with tech experts and young people, and analysis of the trends in the chatbot will help inform further AYSRHR programs in India by identifying young people's concerns. The YP Foundation is a youth-led organization that facilitates young people's feminist and rights-based leadership on issues of health equity, gender justice, sexuality rights, and social justice. And our final pitch innovation that I wanted to highlight is from the Blind Youth Association in Nepal. And their innovation is guidelines on disability inclusive FP-SRH services. So the Blind Youth Association Nepal was able to develop these guidelines to address a gap among young people in Nepal that, despite having certain rights, feelings, and sexual desires and needs, people living with disabilities in Nepal often have their family planning, sexual and reproductive health needs unmet. They face barriers that include limited access to services, stigma, ignorance, and negative attitudes, which result in low uptake of these services. Nepal's constitution does provide for laws that protect and provide for these services and provision of these services. However, the Blind Youth Association Nepal was looking to reduce barriers. The guidelines include information on access, minimum standards, methods, and ways of reducing barriers for people living with disabilities to access safe motherhood and other FP or SRH services. So in collaboration with the Ministry of Health and the Population Family Welfare Division of the government, the guidelines were created and published in Pali on the Family Welfare Division's website. And the guidelines were also available in English. The Blind Youth Association Nepal was able to share these guidelines through many avenues, and the organization conducted a validation workshop among representatives from the Organization of Persons with Disabilities and held meetings with the Family Welfare Division and other experts on the development of the guidelines. And they continue to raise awareness around the guidelines, how to implement them, implementing trainings on sensitizing folks to those guidelines, and training service providers as master trainers to train other service providers in their implementation. So these are just 3 examples of what Erin was highlighting in terms of how knowledge management can really produce effective results when it comes to AYSRH programming, and really impact equity, impact partnerships, impact resource mobilization, impact access to services, access to information. So we're going to move on, or we're going to pause now for a reflection. Please add any questions you have to the chat. And in the interest of time, add any questions you have to the chat. And I'm going to move on to the next section, and we will stop before we go into our small breakout rooms, and we'll address all the questions kind of at the end, after this section. So I'm going to move on to the assessing KM needs section first, and then we'll come back to any questions. So if you have any questions about that section, please add them to the chat, and let's dive into assessing KM needs. So to do that, we're going to take a look first and foremost at our knowledge management roadmap. So the knowledge management roadmap is a 5-step systematic process for generating, collecting, analyzing, synthesizing, and sharing knowledge. The KM roadmap can be used at the project level or at the activity level. And it's a useful tool that can be used as a reminder when starting any new KM activity. And these 5 steps probably are fairly familiar to anyone involved in project management, because it follows similar steps, including assessing needs, designing a strategy, creating and iterating, and mobilizing and monitoring, and then evaluating and evolving. What's different is that the steps specifically apply to knowledge management work. So therefore, this roadmap can really be helpful to guide health workers and professionals when applying KM systematically and strategically. So I'll provide an overview and really focus in on this assessing needs step. All right, so this is just the overview of the KM roadmap. And in the interest of time, I'm not going to get into all of these steps in a lot of detail, because we really want to hone in on the first step of assessing needs. This is the overview of the KM roadmap. So you would, follow from step 1 of assessing needs, designing your KM strategy by all team members to map out your KM activities, creating and iterating, thinking about your KM tools and techniques along the matrix that Erin introduced previously that asks you about your asking, telling, publishing, and searching approaches. You would mobilize and monitor, so implement those tools and techniques, and then make adjustments accordingly, as well as evaluate and evolve, right? So look at how you're evaluating and what you want to share out after that evaluation. So next slide. So for step 1, you're going to look at the goal of step 1 is to understand the extent of the health program challenge and identify how a KM need can help solve it. So specifically, the goal of this foundational step is to discover the information needs and gaps of your health program staff that, if addressed, could help improve the effectiveness of your program. And depending on the findings, knowledge management can maybe a central part of the solution, or it could play a supporting role to other strategies. And this step is relevant regardless of whether you're assessing the needs of your internal employees or external audiences. And many people really want to skip over this step. They really want to, because they think it's research, and they really want to just dive into the doing. Or maybe they think that they already know. Maybe they think that they already have a grasp on what the needs are. But we really encourage people to spend some time on this step, really thinking through these issues systematically and really kind of going back to the audiences, or to, you know, the employees, to the external audiences, and asking more questions. It doesn't have to be a large endeavor with a big budget, and some casual yet focused conversations can provide a really solid foundation. And the output is a briefly and clearly expressed problem statement of the health challenge and problems, and how KM can help solve that. Next slide. So again, why conduct a needs assessment? This can really help improve the quality of decisions and performance outcomes by aligning KM activities with assessment findings. More specifically, looking at through a needs assessment, you can develop evidence-based and needs-driven programs and policies for your users and audiences, and address knowledge gaps and improve knowledge exchange systems and processes. It covers both explicit knowledge, so you're looking at not only information and documents and data, but you're also getting at tacit knowledge, right? So what skills do people have? What experiences do people have? What abilities do people already have? Or maybe what are they looking to gain? What skills do people feel like they need? What experience do people feel like they may desire or would benefit them to be able to address a problem? And again, it identifies knowledge flows and knowledge gaps. Perhaps knowledge isn't getting to the right place, or perhaps knowledge is getting stopped somewhere, and that's something that could be addressed. And again, it's also something, you know, we have it as step one, but that doesn't mean that it necessarily always just needs to be done at the beginning of a project. It can be done at the beginning, and we encourage it to be step one, but it can actually inform a course correction. Maybe it needs to be an iterative process, and maybe it needs to be done to course correct. Maybe something isn't working well and you need to go back to step one. And we also encourage that as well. Next slide. We also encourage a needs assessment with an equitable lens as well. And we encourage to do that, to start with the ultimate outcomes your health program is trying to achieve. And think about the KM tools and techniques and whether they meet all the needs of key audiences equitably. So to help plan your needs assessment with equitable KM as your key goal, keep these points in mind. For the KM tools and techniques, account for power dynamics and other barriers that may limit access to these tools for certain subgroups. For instance, access to the internet may be different based on whether someone lives in an urban area or a rural area. And it's essential to reflect on what is considered knowledge. For example, whether only evidence-based knowledge is considered to be knowledge, or whether experiential knowledge is also valued. Who makes those decisions in you know, your organization, in your health programs? Those can be really valuable aspects to understand. And beyond that, consider who's involved in the process. What are their preferences? Equity can be affected depending on how the process is implemented or how policies and norms influence or drive decisions. The equity checklist in the KM training package is a valuable resource to incorporate aspects of equity into assessing needs. Next slide. And a needs assessment with a behavioral science lens is also a valuable tool as well. So behavioral science is a scientific approach to understanding human behavior through both observation and experimentation. And for KM, key behaviors of interest are information seeking, sharing, and use. So behavioral science can be used to make knowledge management more effective, because knowledge management also involves encouraging people to perform certain behaviors. So for KM, the key behaviors are seeking information, sharing information with others, and using that information to improve your work. So we can therefore approach our needs assessment with a behavioral science lens to guide questions that will help us better understand the challenges or biases that people face when performing these types of KM behaviors, as well as opportunities that we can capitalize to motivate more of these behaviors. For instance, if we'd like to understand perhaps what are the barriers for seeking information, right? We can ask targeted questions that get to that information. Or when we think about, what would motivate somebody to perform more of a desired behavior. Let's say we're trying to influence employees to access a certain platform where we intend to keep documents. And we want to understand, let's say we ask, what are the barriers to accessing this platform? And if an employee says, well, it's really a barrier is time. And we think about maybe what could be a motivation? Well, we could think about maybe how do we make it easier, or how do we reduce the time that it takes for somebody to access that platform, right? Maybe there are things about the platform that could reduce the time. Maybe we could reorganize the platform to make things easier to access. Maybe we can pin certain documents so that when they come to the homepage, they just click on one thing and it takes them exactly where they need to go. So they don't have to make, several different clicks. They don't have to access many different folders. They don't have to go through different, pathways to find the information they're looking for. It may seem like you're not cutting down time that significantly, but maybe to that employee, you're really reducing that time that it takes to access that information. So that's just one example, and it could be small. It could be something, as small as that. Next slide. Okay, so one of the key steps in a knowledge assessment is to review what's already known. So to do that, next slide. We're going to look at, common sources of existing data. And many of you are familiar with this, so I'm not going to get into too much detail here. This exists and is, kind of available to many of you. Literature reviews, evaluation reports of other relevant health programs, management reports, policy documents, what other organizations are producing, so what do other data reports look like, action plans, training needs assessments. You can also look at things like the WHO, like relevant, international guidance documents, things like that. Next slide. And then, reviewing what's already known can serve as an opportunity to identify gaps in knowledge around, sharing, seeking, and usage behaviors, right? And these are some examples of the biases or barriers that we identified through our behavioral science research and inquiry with family planning and reproductive health professionals in sub-Saharan Africa and Southeast Asia and the United States. So looking at these gaps in knowledge around sharing, seeking, and usage behavior among the target audience can be really helpful. So these are several kind of biases that you could consider. And perhaps you maybe think about these going into kind of, looking at, the information that you're collecting or assessing what's already there. Or, these are things that you're looking at when you're asking new questions, right? And what you're looking to find. So the next step is to collect new data if you need to. So collect new data if needed. So to collect new data, these are common methodologies that I'm sure all of you are familiar with. So you would assess, a situation analysis, right? So what is actually happening? Who is involved? What is the context? What are the demographics? You could conduct surveys with your target audience. You could use qualitative methods, these key informant interviews, similar to the process that Knowledge Success undertook. You could do focus group discussions, network mapping. So this is kind of speaks to a like stakeholder mapping, right? So who is connected to who? Does one person's decision-making influence another person's decision-making, which in turn influences another person's decision-making? And how does that work? And so this is a visual that you could use and literally a map. You're drawing lines between folks. And those lines are lines of influence, right? So you might draw a line for financial influence, or you might draw a line for like social capital, right? So like relationships, which are very important measures of social standing or social capital, or a person's standing in the community. So those can be valuable tools to understand how knowledge flows and who gets to make decisions about what is considered knowledge and how that works in different contexts. And then this organizational assessment as well. So understanding, what knowledge management looks like at an organizational level. So, usually, it can be helpful to combine a lot of these methods, right? So there's certain levels of data or certain levels of information that you're going to get from qualitative methods that you're not going to get from a survey. However, surveys are more accessible oftentimes to audiences that may not be able to participate in a qualitative method, for instance, like a busy mom who you're trying to understand what her information needs are, may not have time to sit for a focus group discussion, but she may have time to fill out a survey. So that may also be something to consider as well when you're choosing your methods to assess knowledge needs, is to choose the most appropriate method for your audience. All right, next slide. So, and then we get into analyzing and synthesizing data. And analyzing and synthesizing data is something that is a systematic process, and can involve a lot of different people, and I think is definitely important, and it's valuable to have a lot of different team members involved in this process, because different people offer different perspectives when you're looking at different pieces of data, especially qualitative data. Some people, could read through like a focus group discussion transcript and pull out different things that could be meaningful than other people. And so this one is something that we're going to highlight for kind of the data visualization. So this is a tool. A user persona is a tool that can help you articulate what is known about an audience member or a group in terms of what they say, think, feel, and do regarding a specific behavior. So a user persona is typically split into 4 quadrants. So what they say, what they think, what they feel, what they do, and it also sometimes indicates pain points. So what are challenges, what are gains, so enhancers and opportunities. All right. So this is the illustrative user persona template for knowledge management. And this user persona template is not filled out, obviously. So this is what we've organized into, this quadrant, right? So it starts with step 1, briefly describing your work environment, and it asks a few prompt questions. So these prompt questions are, what is your organizational culture like? These are very, very basic. How's your internet connectivity? And then step 2 gets into what kind of FPRH information do you commonly ask for, or do you commonly look for? So like, please list. These can be topics, these can be types of information, right? So like, are you looking for like policy reports? Are you looking for data visualization? Do you want charts? Like, are you looking for statistics? Do you want, data points, things like that? And then it gets into more specifics, right? So step 3 is to select one type of FPRH information from step 2 and to highlight it, right? So, and then to really answer the questions below using that information in mind. On the left-hand side, you have finding that information. And then on the right-hand side, you have sharing that information. So on the left, you're looking at how do you go about finding that information. On the right, you're looking at sharing that information. And then below, you're looking at using that information. And then at the bottom right, you're looking at overall how you feel about your KM role in FPRH programming. So next slide. Okay. So I mentioned that we would pause for reflections or just any questions before we get into our practical exercise. Are there any questions in the chat or anything? It doesn't look like, I don't see any questions in the chat aside from we will be sharing these slides. Yes, definitely we will be sharing these slides with the recording. So that will be sent out. And okay, so I don't see any questions. So I'm going to move us along to the practical exercise and send us into breakout rooms. And to do this, we're going to be going through the persona. And I sent this out previously last week. We're going to be working in small groups. Everybody is going to be completing their KM persona individually. But we're going to be working in small groups so that you have the opportunity to ask questions. So this is meant to be a very safe, very small, environment. So you can ask questions, you can discuss with each other, compare or, really share with each other, right? So if you're noticing similarities, it's meant to be kind of a, sort of a step-by-step process of going through the persona. So the goal is not to rush through completing the persona. The goal is really to understand the template. And the goal is really to understand the purpose of it and really to understand and to ask questions. So if there is anything that's unclear, please feel free to ask the small group facilitators. Erin will be a small group facilitator. Mina will also be a small group facilitator. We are joined by 2 of our Asia team members who will be small group facilitators, as well as Pranab and Sophie. They are excited to work with you today. So I will be opening the small group rooms. And to access the rooms, once I open them, you should get an invite to join your room. And I'm going to just randomly assign folks. It should just pop up for you. Like it should just have a please join X room. And if you click that, you should just be taken automatically to that. If you don't see that, please select breakout rooms from the menu that appears at the bottom of the Zoom screen. You might have to select the 3 dots on the Zoom menu if you don't see that. And it'll bring up like more options for the Zoom menu, and you can select breakout rooms from there. Or if you're on your phone, you might have to like scroll over on the menus, and you should be able to see the breakout rooms on the bottom.